Congratulations on completing Phase 1 of your medical school education. As you enter Phase 2, you will be spending more time in the clinical setting interacting with patients, which includes the potential opportunity to practice your bedside ultrasound skills that you have already been working on. In this presentation, we will prepare you for patient interactions when these opportunities arise. Be sure to pay close attention to the expectations we have for your discussion with patients regarding the use of point-of-care ultrasound for educational purposes. When performing a new skill, especially in the clinical setting, it can be intimidating. The goal of this presentation is to prepare you to interact and discuss the use of point-of-care ultrasound with a patient in the hospital or clinic. The questions we plan to address include: when can I perform an ultrasound on a patient? What do I say to the patient? And what do I do next? First, let's discuss when you can perform an ultrasound on a patient in the clinical setting. This question can be answered quite simply. You can only perform an ultrasound on a patient if your preceptor or attending has given you permission to do so. While ultrasound does not submit any patient to any radiation or harming effects, you must be sure that you are getting this approval before performing any scans in the clinical setting. Preceptors or attendings have different levels of comfort or familiarity with point-of-care ultrasound and its use and application. When you are on their service, you are acting under their medical license. So if they do not want any point-of-care ultrasound performed during the rotation, then be sure to follow their guidance. If you are unable to perform your required scans in the hospital or clinic, there are multiple other options, including scanning volunteers or peers that have signed the ultrasound consent form. Additionally, there are simulators available on each IU School of Medicine campus that can be utilized to meet the Phase 2 PoCUS requirements. Take-home point: be sure that you have permission before performing any point-of-care ultrasound exam on a patient. Next, we are going to discuss what you should say when getting consent to perform an exam. If your preceptor or attending is comfortable using point-of-care ultrasound in the clinical setting, you may perform these exams alongside the care team as part of their clinical evaluation. In those situations, your preceptor will help lead the discussion of permission and the interpretation of results. You may, however, have the opportunity to perform scans independently that are done for educational purposes. Again, as we discussed, this is only with prior approval from your preceptor. In these situations, it is very important that you are clear about the limitation and goal of the scan. We have created an example video you can use for reference on how to approach this conversation.
Hello.
Hi there.
Hi, I'm one of the medical students.
Nice to meet you.
So I'm Molly Powell. I'm one of the medical students working with your care team today.
Hi.
Hi, I'm wondering, I would like to do an ultrasound of your heart for my own education. I'm still in the learning phase of this, so this would purely be educational. I'm not able to actually interpret it. Now, if I do see anything that seems abnormal to me, I would, of course, mention it to the care team. I'm wondering, would you be okay with me doing this?
Yeah, of course. Is there any cost associated with it?
No, you won't be charged for this since it's just an educational exam.
Okay, that sounds great. After you have completed the educational ultrasound, the immediate next steps you should take include: 1. Be sure to thank the patient. As discussed, these educational exams are done for your education and do not help the patient. Be sure to say thank you to them for allowing you to learn. This is a good time to mention that patients do not have to consent to these exams. If they do decline when asked, be sure you are respectful of their wishes and thank them for their time. Additionally, be sure you are not in the way of clinical care. If you are performing an educational scan and other members of the care team enter the room to provide care, such as taking blood, needing to take the patient to imaging, performing clinical evaluations, or anything else that is part of their care, be sure you excuse yourself and do not delay the clinical care process for your educational scan. While these exams are not diagnostic, if you do see an obvious abnormality, please reveal this concern to the care team. Please avoid saying any statements to the patient such as, "Everything looks good," as this is not a diagnostic evaluation, and there are limitations of your skills, the handheld ultrasounds, and even limitations of point-of-care ultrasound. You do not want to falsely reassure patients that there are no abnormalities when these may still exist. Just end the discussion by thanking them for allowing you to learn. When you are done, be sure you clean the probe. Cleaning instructions can be found if you follow this QR code. Last, you have the opportunity to submit your exam to the PoCUS curriculum team for review and feedback. This feedback will solely address how you can improve your scans and will not give feedback regarding diagnostic evaluations. Please refer to the PoCUS modules and Canvas on how to submit your scans. As a reminder, it is important that you do not enter any protected health information into the handheld devices. Requirements for PoCUS will vary depending on the clerkship. Please refer to the dedicated PoCUS module in the Clerkship Canvas course for these requirements. You may be required to perform a self-attestation for each of your required PoCUS scans. If you are unable to complete these requirements, please follow the instructions to set up remediation with the PoCUS team. Additionally, there may be a self-reflection present for you to complete in Canvas. The purpose of this self-reflection is to encourage you to evaluate the quality of your scans so you can continue to improve your performance with each repetition. Thank you for your time. Please don't hesitate to reach out to the PoCUS curriculum team with any further questions or concerns. Happy scanning.